Hello, everyone. This is Dr. Allison with Little Black Bag Medicine, and today we are going to go through what an example report of finding looks like in my practice. So, this is the packet that you get after we have our initial consultation that tells you everything that we talked about, what your plan is. We go through your medical testing and everything like that. So, that way you have a clear plan moving forward. You know exactly what to do and how to do it. And you can see those changes happen really fast because you know exactly what to do. So, what you don't see in this report is all the work that goes into it. So, as a patient, you fill out your health history form, everything that's going on. You fill out your symptom survey form, you fill out a brain health survey form as well. And we always do an introductory consult that's free to you. And we talk for about 30 minutes to talk about what your main complaints are, what's worked, what hasn't worked. Have you had any testing? Do we need to order any new blood work or saliva testing that's specific for you? Because we want to do the testing that's right for you and not just do a whole bunch of testing that doesn't apply to your issues. So we can keep it really simple and be very strategic about this. In the main report, because this is just an example, you can see on the screen here that it says main complaints, medical history, surgeries, hospitalizations. We look at prescriptions, supplements, allergies. We go through your lifestyle, every meal. What are you drinking? How are you sleeping? What's your gut health? What's your hormone history? You always send me any past medical testing that you may have and any current medical testing that we've done, whether it's blood work, CAT scans, MRIs, ultrasounds. If we do stool testing, urine testing, everything, I want to see it all to go through it so I have a really big picture of everything else. And then we go through the symptom survey and brain health surveys together. So that's a big portion of our consultation because we want to know everything. We don't want to skip over something because the tiniest little bit of information can give us the key to what's going on for you. So after we go through all of that, then we get to the review here, which is down here. So I give you an overall view of what I think is going on, what we need to work on. So for this person, we're working on blood sugar, adrenal fatigue, liver congestion that showed up in their medical testing, and then some hormone health issues. A lot of people come with triglycerides and cholesterol issues, so we can work on that. And of course, you always want to continue to take prescribed medication as directed by that physician. So we don't want to cut anything out there. When we do go through your testing, I put it up on the screen for you. Since my practice is telemedicine, we always meet over video. So that way you can see your testing in real time. I can point out these numbers to you and you always get a copy of that as well. And then I put the big things up that you might want to know of the biggest takeaways from that testing. So for this person, we had done a stool test and some updated blood work. So we would know what was going on with them. And you can go back and look at my reviews of the GI map to see what I look for and what we look for in that test, because that is very helpful for people who have digestive disorders, hormone disorders, and autoimmune conditions. Then we get into the 90-day plan. So the way that I work with my patients is in a 3-month program because I want you to have, first of all, accountability. And second of all, me being there to hold your hand to help you understand if you have any questions, if you have any concerns, if you're feeling better right away, we can like speed things up. Or if you're not feeling better, what do we need to change? What do we need to add? So I always set goals for us. So for this person, for our example, we wanted to improve insulin signaling in the cells to reduce the hemoglobin A1C, so which is the pre-diabetes. We want to make sure that we get the blood sugar under control, support the liver so we can get those blood work numbers down and reduce the pain. And these goals are always revolved around your main complaints. I never want to ignore what you're going through. So we always list those at the beginning of the report. So you and I are always on the same page. We're always working on the same thing together. Now, you may come and say, well, I have a ton of pain. And I'm going, let's talk about insulin. You're like, well, that doesn't make any sense. But when we look at your blood work, we look at the testing, and the pain may be coming from inflammation from somewhere else, right? So we want to figure out where that root cause is and work on that. So this is usually the hardest part, but we always talk about food management. And this is a very small chart from what I usually make. And you can see breakfast, lunch, dinner, and snacks. I kind of give them a bigger picture like protein, carbs, and fat, protein, and veggies. This is typically different for each person and doesn't vary too widely, but I don't make this chart until I sit down and talk to you because I want to know, what do you like to eat? What do you have time to make? What is your blood type? What is your insulin type? What is your stress type? Like, all of those things will impact these specific types of foods. So no, this person is not only having oatmeal for breakfast, only having a salad for lunch. We have much broader things. This was just an example, but we can have a good focus for lunch. So I was having pasta for lunch and pasta for dinner. So we're changing those things to proteins and fats, proteins and veggies. What can we add in based off of your taste? So don't worry, this is not the only thing. Most people, I do give this food and blood sugar management lecture to about eating every 2 to 3 hours so we can get your insulin signaling, we can get your blood sugar stable, never skipping breakfast, eating within waking up. So you're already getting half of a treatment plan right here. So always combine a carb with a protein. Don't just have bread and call it a day. We want to add something to that. Before eating, do 4 rounds of 4 squared breathing. So that means you take a deep breath in to a count of 4, hold it for 4, let it out for 4, and hold it for 4. And do that because it helps reset your sympathetic nervous system to calm down your stress, to turn on the parasympathetics, which is your rest and digest. So that way you will have more digestive power. Most people are eating at their desk, in the car, and while they're rushed, while they're stressed. And we don't want to do that. We really want you to be able to slow down, especially to help digest, have a healthy gut. Walk after eating, even if it's just for a few minutes to help move things through your system. For this person, they needed a protein snack at night to help with insomnia. And after, this is specific for this person, but 1 month of continual eating, then we might try intermittent fasting or keto. So depending on what's going on with that person, especially their hormone type, especially when we're talking with women who have PCOS or infertility type issues or they're menopausal, these food settings look completely different based off of your hormone type. So if we can get your blood sugar managed, then we can try specific food type eatings like keto. And then most people I have track their food either on Excel and they message it to me before their consultation. Some people handwrite everything and that's fine. They take pictures and email me. Some people do great with carb manager apps or MyFitnessPal, and that's great. So whatever you can do to get that information to me so we can look at what specific foods that you're eating. That's usually the longest part, the hardest part to get through. I always like to add in stress management, like a mindfulness app to do emotional freedom technique. There's videos on YouTube. I have a meditation group called the Soul Elements, and we post monthly meditations there. So something that can help you, that you can do and fit in with your time. Of course, exercise and movement is in there. This is also dependent on you, your time, your body type, your blood type. All of those things impact this. So for this person, we talked about daily stretching. I added, let's see, dailyohm.com is a very simple website. It's inexpensive. You can pick a course like yoga or something that really works for you. You can always grab a free class on YouTube as well. So we try to keep this really easy. For some people, we do focus more on weightlifting or body weight exercises. Some people need to just start with stretching and slow movement. So this is all catered to you and what you need. Then we go into supplements and essential oils. So most people we have taking supplements because they either have an infection, they have, like this person, we have the yeast nil. So that way they can get working on that GI map, everything that was going on there. This person also, we did a lot of blood sugar support for. So this is Glycin Synergy. You see is 4 pills in 1 pack. So it's conveniently packaged and you get 4 different supplements. You don't have to have a ton of bottles sitting around your house, which is wonderful. And again, this is all specific for you. No one ever gets the same supplement pack or system because you're completely different and your needs are going to be different. This person was also already a doTERRA member. They were already using oils, so we added in a couple extra things like Terra greens, lemon, clary calm, which is a hormone support roller, and then turmeric as well. I don't always recommend essential oils or doTERRA. Again, it just depends on what you need, what you already have. Some people are already taking a ton of supplements, so I have you list those out. Sometimes we stay on those, sometimes we don't. If they're not the right thing or the right brand or they're not working, you got to figure that out for you. And then we have a goal number 2 to begin focus on weight loss after 30 days, reduce inflammation, all of those things. So we have these next steps. And of course, we have additional testing needed, like we want to reevaluate blood in 3 months. If hormones don't balance out within that time, we want to do a saliva test and rule out a couple other things from their metabolic survey, like small intestine bacterial overgrowth. So that way, we always have a game plan to say, all right, if at the end of the 2 months or the 3 months, you're not feeling 100%, like, what are we going to do next? And here's those things. I always have, not always, sometimes I have referrals and ancillary care, like referral to pelvic floor PT or abdominal PT, especially for women who have any prolapse issues, bladder or fecal incontinence, pelvic pain, things like that. Sometimes we have to refer back to primary or gyne for exams because we want to make sure that if there's pain issues or incontinence issues, that everything's okay there. A lot of times I refer out for sleep studies as well. So again, that's also very personalized about what you need, what we think is going on. And then the next steps are ordering your supplements, starting your care, emailing me your food intake. For some people, we have in timing of symptoms like digestive or pain, things like that. We schedule your consult. This says 4 weeks. Usually we do 2 weeks because we want to make sure things are going right. And then we have as many consultations as you need over those 3 months to get to work, to focus on you. And the program includes text and email access during business hours on the weekdays. So we can really make sure that you're getting the support that you need. So that is an example of a report of findings. I hope this was helpful. And if you have any questions and need any support, feel free to message me on Facebook and we will get you taken care of. All right. Or you can schedule a introductory free consultation online at littleblackbagmedicine.com. All right. Thanks, everybody.